Bonjour et
Hello, thank you for joining us here today.
Canada's Chief Public Health Officer, Dr. Theresa Tam, the Deputy Chief Public Health Officer, Dr. Howard New, the Minister of Public Services and Procurement, Anita Anand, by video link, the Minister of Innovation, Science and Industry, Navdeep Bains, et bien sûr le Président du Conseil du
And of course, the President of the Treasury Board, Jean-Liv Duplan.
Health to answer your questions. Dr. Tam, please.
Good afternoon, bonjour à toutes et à tous. I will start with the latest numbers on COVID-19 in Canada. There are now 85,998 cases, including 6,566 deaths, and 44,911, or 52%, have now recovered. Labs across Canada has tested over 1.5 million people for COVID-19 to date, with about 5% of these testing positive overall. Over the past week, we have been testing an average of 22,300 people daily. As we reopen parts of our society and start to get out more, I've been reflecting on the needs of Canadians living with chronic illnesses and the unique challenges they face during these unusual times. Establishing a new normal way of living with COVID-19 will be harder for those individuals. For some, their medical conditions or the medications they take may place them at higher risk of severe illness due to COVID-19. These individuals and those who care for them will need to consider carefully how best to manage their illness while navigating the direct risks of COVID-19. Others may be struggling to access the health and social services they need to cope with the day-to-day realities of their illness. People may be anxious about accessing these services, even as they become more available in the coming weeks. Delaying care can lead to worse health outcomes, so I encourage Canadians to contact your care providers to learn about the in-person and virtual options available to meet your needs safely. Today, I also want to talk about children and adults who live with chronic pain, which affects 1 in 5 Canadians and is often invisible to others. We know that unmanaged pain can lead to decreased mobility, mental illness, problematic substance use, and even suicide. This is why it is so important to ensure access to pain care services and supports even during times of crisis. If you or someone you love needs help managing pain, please know that you're not alone. There are resources out there. The Canadian Pain Task Force, an advisory body set up by Health Canada, has compiled a list of resources on the task force webpage for Canadians living with pain during COVID-19. Until the end of this week, the task force is consulting Canadians through the letstalkhealth.ca portal to help the Government of Canada better understand and address the needs of people who live with pain during the pandemic and beyond. I encourage all Canadians with an interest in improving the lives of people living with pain to share your ideas and experiences with the Canadian Pain Task Force. Thank you. Merci.
Okay, thank you, Dr. Tam. Et maintenant, je donne la parole à Dr.
Have the floor. Thank you. Good afternoon. As usual, I will start with the latest numbers on COVID-19 in Canada. There are now 85,998 cases, including 6,566 deaths, and 44,911 people are now recovered. Labs across Canada have tested over 1,500,000 tests, and about 5% of these tested positive overall. Over the past week, we have been testing an average of 22,300 people daily. Though some sectors are starting activities, we have started thinking about the cases of Canadians dealing with chronic illnesses and the unique challenges they face during these unusual times. It will be more difficult for these people to find new ways of living with COVID-19. For some, their medical condition or the medications they take may place them at higher risk for severe illness due to COVID-19. These individuals and those who care for them will need to consider carefully how best to manage their illness while navigating the direct risk of COVID-19. Others may be struggling to access the health and social services they need to cope with the day-to-day realities of their illness. People may be anxious even as they become more available in the coming weeks. Delaying care can lead to worse health outcomes. So I encourage Canadians to contact your care providers to learn about the in-person and virtual options available to meet your needs safely. Today, I also want to talk about children and adults who live with chronic pain, which affects 1 in 5 Canadians and is often invisible to others. We know that unmanaged pain can lead to decreased mobility, mental illness, problematic substance use, and even suicide. This is why it is so important to ensure access to pain care services and support, even during times of crisis. If you or someone you love needs help managing pain, please know that you are not alone. There are resources out there. The Canadian Pain Task Force, an advisory body set up by Health Canada, has compiled a list of resources on the task force website for Canadians living with pain during COVID-19. Until the end of this week, the task force is consulting Canadians through the letstalkhealth.ca portal to help the Government of Canada better understand and address the needs of people who live with pain during the pandemic and beyond. I encourage all Canadians with an interest in improving the lives of people living with pain to share your ideas and experiences with the Canadian Pain Task Force. Thank you. Thank you very much, Dr. No.
Public Services and Procurement, Anita Nant. Anita, please.
Thank you, Christia. Before I begin, I would like to thank the doctors, nurses, and caregivers, and all of those on the front lines for their tireless efforts in the battle against COVID-19. I would also like to thank our essential workers who have continued to keep our country functioning during this challenging period. Je pense notamment aux
I'm thinking about members of our security forces, producers, retailers in the food sector, as well as all those who are transporting people and goods throughout the country. Thank you.
applies for COVID-19 testing. As we enter a new phase in the pandemic and restrictions are slowly lifted, we know that testing will play an increasingly important role so that we are able to identify new cases across the country and track the efficacy of our efforts to protect public health. Je peux vous dire que notre gouvernement
I can assure you that our government is determined to support provinces and territories on this front, particularly by providing them with all that they need for testing, like reagents and swabs. As I stated before, because this is very important, a contract has been signed with the corporation Lumine Ultra in New Brunswick to produce reagents in quantities that could enable us carry out 500,000 tests per week up till March 2021.
We have also placed large orders of reagent with 4 premier suppliers that work closely with provincial laboratories. These contracts will allow provinces and territories to access reagent and other lab products required for testing while we remain in negotiation with others. I am also pleased to report that last week 6 letters of interest were sent to 5 companies and post-secondary institutions to procure chemical agents for the domestic production of reagent. When it comes to swabs, we have ordered close to 12 million and have received over 3 million so far. The specific types of swabs necessary for COVID testing remain in very short supply globally, so we are working with domestic suppliers with capacity for 3D printing of swabs and with techniques for swab sterilization. In this process, we are collaborating closely with Minister Haidu and Health Canada in the area of rapid testing and serological testing to build a base supply as tests become approved and more widely available. Turning now to domestic supplies of PPE. In terms of overall domestic supply of PPE here at home, capacity is on the rise, and we are seeing tremendous ingenuity on the part of Canadians as they ramp up and retool production lines. I continue to work closely with Minister Baines on this front, and our efforts to date have resulted in 24 contracts with Canadian companies to help Canada in the fight against COVID. We are also proud to announce a contract with GM Canada. Under this contract, 10 million surgical masks and face coverings for Canadians will be produced here at home in Oshawa, Ontario, over the coming year. GM joins a growing list of companies right across the country who are using their manufacturing capabilities and skilled workforce to help shore up the supplies that Canada needs. Turning now to international procurement. While domestic production of all types of PPE ramps up, we must still continue to procure from abroad to meet our immediate needs. International supply chains are stretched across the board, with global demand for vital supplies continuing to accelerate. C'est maintenant à un rythme.
Cargo flights are now arriving the country regularly. Just last week, 7 cargo flights supplied more cargo to Canada, representing in total 42 cargo flights to China over the last 10 weeks. We now intend to resort to maritime transportation, considering the significant volume of PPEs that could be shipped.
Major shipments have arrived from our own chartered flights and from our suppliers. 2 of the biggest models of planes in the world delivered hundreds of thousands of medical gowns to Canada, bringing our weekly total of gowns received to more than 500,000 as part of 1.9 million overall. In addition, large sea containers of hand sanitizer are also en route, complementing the 5.2 million liters of hand sanitizer that we have received to date, the majority of which was produced right here at home by Fluid Energy out west and Irving Oil in Atlantic Canada. On N95s, we received hundreds of thousands of N95 respirators that this week passed testing and are now being distributed to the provinces. We have also received 7.6 million more surgical masks this week, bringing our aggregate total to more than 87 million surgical masks. Finally, in the past week alone, the number of gloves received has more than doubled, bringing our total to 31 million pairs, which we now know are in need in some of our provinces. In conclusion, with every order and every delivery, challenges remain to be overcome. At this point, we anticipate demand to continue to accelerate in Canada and around the world. It is for this reason that I must stress that while the numbers of deliveries are encouraging and we are definitely moving in the right direction, my message to my team is to be vigilant. We must keep going. That is precisely what our government intends to do. I want Canadians to know that we will remain steadfast in our efforts to send safe and effective supplies to our frontline healthcare workers as quickly as possible. Merci beaucoup. Thank you so much.
Okay, thank you, Anita. And now we will hear from our Minister of Innovation, Science and Industry by video, Navdeep Bains. Nav, please.
Merci de me donner l'occasion.
Thank you for giving me this opportunity to present an update on the mobilization of the industrial sector to fight COVID-19.
Of crisis, we've seen and continue to see Canadian companies across the country making tremendous contributions to our healthcare system. Pour faire face à...
To face the crisis, many people are getting together and adopting new tools and objectives to innovate like never before. Canadians can be very proud of this.
Stepping up to the plate. And the ingenuity and creativity they are bringing with them is incredible. Since we issued the call to action, over 6,300 companies have contacted us to offer their expertise and capacity. And of those, more than 700 have retooled to supply personal protective equipment. Nous avons agi rapidement.
We acted quickly to launch a call for action, analyzed letters of intent, and issued purchase orders.
One of Canada's Nobel Prize-winning researchers, Dr. Art MacDonald, we've been able to finalize a purchase order of 10,000 ventilators. Dr. MacDonald has led a team of Canadian scientists and engineers from around the world to develop an easy-to-produce ventilator using off-the-shelf, easily accessible parts, and we were able to partner with them, a company called Vexos, in Markham, Ontario, to bring this vision to reality. I'd also like to announce that we have signed 6 new letters of intent to strengthen Canada's domestic testing capacity, a critical tool necessary to getting our economy back to normal. Oakville-based GL Chemtech, Biobasic Canada in Markham, and Edmonton-based Ron Pharmaceutical will be producing key chemical inputs for testing. Galeness Sciences from Montreal, as well as a partnership between McGill University's Centre for Structural Biology and the National Research Council of Canada, are working on producing key inputs and enzymes. Quebec-based Plastics More is retooling to manufacture critical plastic components necessary for COVID testing. And we're also finding through the NRC Industrial Research Assistance Program 6 new early-stage tests, some of which will expand Canada's existing capacity to diagnose COVID-19 infection, and others which will be able to detect antibodies in a patient's blood. Artron Bio Research in Burnaby, Custom Biologics in Toronto, and Biolytical Labs in Richmond are developing point-of-care testing kits. As mentioned, Luminultra Technologies in Fredericton are producing lab-based test kits and reagent. 2 companies, London's Diagnostic Biochem Canada and Response Biomedical in Vancouver, are developing serological tests to detect COVID-19 antibodies. And a few weeks ago, as part of our the NRC asked small and medium-sized businesses to come up with alternative materials that could be used in large quantities to manufacture N95 respirators and surgical masks for healthcare workers. 3 companies were selected from that process: Steadfast from Granby, Roswell Technologies based in Calgary, and Performance Biofilaments in Vancouver. These companies using material sourced and manufactured right here in Canada. And over the past few weeks, we've also leveraged our innovation superclusters by tapping into their national network of over 2,400 members. The NGen Supercluster has been supporting COVID-19 related projects, including one led by Eclipse Automation from Cambridge, which is retrofitting traditional N95 machines to be able to produce new Canadian mask designs with Canadian intellectual property. And the Digital Supercluster has approved a number of projects focused on expanding our ability to detect COVID-19 cases, providing virtual care, and accelerating the development of vaccines and treatments using artificial intelligence. As we work together with the Canadian business community, I have every confidence that we will continue to deliver on breakthrough solutions, retool where we can, and scale up to meet our needs during the crisis in the near future. Thank you very much. Merci beaucoup.
Thank you, Nav. Et maintenant, je donne la parole au président.
Now the President of the Treasury Board. Thank you, Christia. Good day, everyone. The Prime Minister and my colleagues made some important announcements this morning. The first has to do with Canada's role on the international scene to fight against unemployment and poverty that is created by COVID-19. The second announcement has been made by Ministers Bain and Annan concerning the significant progress that has been made regarding supplies and distribution of medical equipment and personal protection equipment. And we also have some good news, funding of 700 posts for young people in the agro-food sector, and also the federal government having received a request for the extension of the deployment of armed forces in long-term care facilities in Ontario and in Quebec. Thank you. Now we are ready to take your questions.
We're going to start on the phone with 3 questions, then 3 questions from the room, and so on. 1 question, 1 follow-up. Operator, over to you.
Thank you. Merci. If you have a question, please press star 1 on your telephone keypad. Si vous avez une question, appuyez sur étoile 1 sur votre téléphone à clavier. La première question est de Hélène Buzetti du Devoir. La parole est à vous.
Question from Le Devoir. Good day. My question is for you, Madam Freeland. Today, Mr. Trudeau said that the federal government is open to regularizing the situation of some refugees who worked in the long-term care facilities. It's not clear to me. Are we only talking about regularizing asylum seekers who arrived illegally through Roxham or other means, or are we talking about all refugees whose files will be quickly addressed? Could you please clarify that situation? Answer. I will try. As the Prime Minister said, we've always understood the importance of immigration for our country. Our government is open to immigration. Today, we understand that the people of Canada and of Quebec are extremely appreciative of the work that these asylum seekers are doing. And people want to thank those people for the work. We do understand. At the same time, we believe that we need to do things properly. We need to look into how we can do that. Yesterday, I spoke with Minister Medicino, our Minister of Immigration, and as the Prime Minister said, Marco is looking into that issue in close collaboration with Quebec to find out what we can do. Follow-up question. Could you please clarify whether you are talking about people, the irregular asylum seekers who came in through Roxham, or are we talking about all refugees? And could you tell us what you discussed with Premier Logo about that? Could you please repeat the question, the answer in English, and we'll come back to that.
Said today, Canada is a country built on immigration, and our government is very open towards and welcoming of immigrants. We understand that there is a very specific situation right now where many people in Canada and in Quebec are particularly grateful to the refugee claimants who are doing such important work taking care of our elders. People are grateful. People want to express that gratitude, and we really understand that. We know also that it's very important in all issues, very much including immigration, to do things properly and carefully. Marco Mendicino, our Minister of Immigration, is looking into this issue very carefully and closely, as the Prime Minister said today. Concerning
the other question, the specific issue we believe concerns asylum seekers who are doing absolutely extraordinary and essential work now. That being said, you are right. That's a big question. The Minister of Immigration, just as the Prime Minister said, is looking into the issue. As I said before, we must do it and will do it in close collaboration with Quebec. Thank you, Madam Vice Prime Minister. Operator, next question.
Merci. Thank you. The next question is from Kelsey Johnson from Reuters. Please go ahead. Your line is now open.
Hi there. Thank you for taking my question. My question is for Dr. Tam. Dr. Tam, we are in the middle of a heat wave, and many of the traditional places that vulnerable populations would go to cool off, like swimming pools, splash pads, malls, movie theaters, are all closed to slow the spread of the pandemic. I'm wondering what your advice is to municipalities and other officials who are going to have to find a way to ensure residents can cool down in the next 3 days while ensuring the COVID outbreak doesn't spread.
Yeah, so addressing multiple health issues is obviously going to be a challenge. I think from a public health perspective, we know that it's the trying to do this while respecting actual distancing or providing other measures is the key. I think whatever municipalities come up with as individual solutions, like other spaces that could help to be opened up, for example, must still respect the public health measures, and they need a plan in terms of ensuring there are sick people still stay at their residence as much as people can assist with that. And then all the other measures, includes the hygienic measures, should be in place if people are looking for these solutions. So like any other setting, absolutely plan very quickly with the local public health authorities on how do you maintain physical distancing, potential need for mask use if you can't, hand washing, all of those measures will still apply, unfortunately. So that would be one aspect of it that people have to respect.
Kelsey, follow up?
And just as a follow-up, is there any situation where facilities like a splash pad or a beach or that could be opened up without the risk of scenes like we saw in Toronto with just too many people in one space?
I think with the public health officers that there are ways, particularly outdoors, in minimizing the risk while reducing other negative health impacts. So if you're on a beach, then respecting those physical distancing measures can still be done. More of a challenge, I think, is when people have to use communal sort of environments like washrooms and those kind of services while you're at those outdoor spaces is, I think, where the medical officers are looking at that in particular. So the numbers of people that can be accommodated may not be necessarily, due to the restrictions of that open space, but due to sort of access to these common services. So they will have their specific plans to deal with that. That's actually very detailed planning. So listen to your local public health for sure.
Thank you, Doctor. Operator, next question, please.
Thank you. Merci. La prochaine question est de Catherine Lévesque, La Presse canadienne. La parole est à vous.
Question from La Presse canadienne. Hello. To continue in the same vein, my question is for Dr. No or Dr. Tam. There's a heat wave now. Yesterday, we could not give any answer to the fact that the officials of long-term care facilities had to take care of seniors. There was no clear indication. For example, the public health authorities in Quebec. This is my question. What are you recommending that these long-term health care facilities do? How can they deal with the current heat wave? Answer. Thank you for your question. This is Dr. No here. As Dr. Tam already said, yes, we know that's a challenge. according to the public health strategies, we have to make sure that they are still in force. Physical distancing as much as possible, 2 meters, and good hygiene practices like constantly washing our hands. All those measures remain in force. Given the situation of a heat wave, we know it's more difficult. There are still measures that can be taken, for example, using fans to help air circulate. Maybe separating people already contaminated in a long-term care facility, separating them from those who are not ill. If it's possible, it's difficult because each situation in a long-term care facility is unique. We know that it's always better to be outside because with the evidence we've seen, the risk may be higher inside. With the good weather, if possible, people may go into the yard. Maybe the residents may go out in turns while maintaining physical distancing of 2 meters just to get some fresh air outside. Maybe there should be a timetable to make sure that everybody has spent some time outside. Possible to make sure that everyone stays well hydrated. Does everyone have enough water to drink? These are principles that are still in force. We know that challenges remain on the ground. Local health authorities and also the officials of the various institutions would have to plan and make sure that they implement the current public health measures according to the context. Follow-up question. To clarify, Dr. No, would you be issuing national recommendations, or is it really up to the local authorities to decide? Local authorities do not have any recommendations to give. They are relying on the institutions. Would you be issuing countrywide recommendations, or will you be leaving it up to the institutions? Answer. It's very concerning. We did not really discuss it in detail with our counterparts of the Special Advisory Group. That may be something we need to discuss in further detail. For as long as we agree on principles, ultimately, it's on the ground that things have to be done at the local level. We know that even before COVID-19, at the local level, with the heat waves, it's the same principles. People should stay well hydrated. All those measures still apply. The challenge now is how to implement measures for a heat wave, considering the reality of COVID-19. So yes, that's something we could discuss with our counterparts. We don't know what the results of those discussions will be, but ultimately, I think it will be more realistic for local authorities because they are the ones who know better what is happening on the field than those of us here at the national level.
There.
Hi, Tom Perry with CBC. It's a question for Minister Haidu. In regarding this report by the Canadian Forces about the long-term care facilities, I'm just wondering what specifically can the federal government do right now in conjunction with the Ontario government to improve the situation in these homes and moving ahead, making sure that this doesn't happen again?
Thank you very much for the question. And as you know, since the outbreak of COVID-19, we've been well aware of some of the fragilities in long-term care and the long-term care sector. And as the Prime Minister said, and I have also read the report, it is extremely disturbing. And we will be there for Ontario. And, this, as you know, is a provincial jurisdiction in that they have the direct line of sight into facilities, but that we can be there to support them in making sure that seniors have a life. And as I said earlier, in many remarks, this is not something that I think any Canadian wants to see to continue. So I know that the work will be difficult, but we are committed to being there for provinces, including Ontario.
Can I ask, specifically though, you say support, is that money? Is it, what else can you do to try to fix this now?
So thanks for the comment. I think the things that the provinces have indicated they needed help with, we've been there with that help. And that has included, as you know, financial resources, but also people, also expertise in the form of bringing in highly trained military personnel for whom, by the way, we are extremely grateful for their service and their ability to do so quickly. I think that is a conversation that we will be having with provinces and territories in terms of what support practically will make a difference. And I think Canadians expect us to be there for our elders, and we will work very closely with the provinces and territories to understand how best to do that.
And I'd just like to add one thing, Tom, just following on what Patty has said about the Canadian Armed Forces. I think we are all so grateful to them for their literally life-saving work. And I am really grateful to the people doing this work who had the courage to step forward and write this report. It's really, really important, and it's important to recognize that they did that.
Bonjour, Christian Noël de Radio.
Question from Radio Canada on personal protection equipment. So anyone can answer in French or in English. When we look at the equipment that was ordered and what we received, in spite of all our efforts, I think we received only 10% of what we ordered, so we don't have all we need. My question is, what are the challenges? Secondly, is this a cause for concern considering a potential second wave?
Merci beaucoup pour la question.
Thank you very much for your question. There is no doubt that we are dealing with a very competitive market. Challenges still remain. There's a constant flow of goods coming from various sources now and for the months and years to come. So we need plans for now and for the future as well. The figures you see on our website are current figures, but we have other products which will be arriving in the future as well. Lots of products will be arriving in the future. Thank you very much. Anyone on the same question? I will go to my second question then. Go ahead, Mr. Baines. Go ahead.
Yeah, no, thank you very much. Just to build on the comments made by Minister Anand, today what we announced in the Made in Canada project update is strengthening local supply chains as well. This is about building domestic capacity, but also identifying the key inputs and the raw materials that we need to build this personal protective equipment. And so I think that is a key component of our strategy as well, and we'll continue to support our entrepreneurs, support local businesses, support highly skilled workers and their ideas. And so this is a complementary strategy. It is built not solely on procurement, but also a Made in Canada project that's designed to invest in Canadians and their ideas. And we're seeing that domestic capacity continue to build in many areas. We highlighted, for example, medical grade gowns, where we use locally supplied construction house wrap, as well as nylon from airbags to meet those medical grade gown requirements. We're looking at key chemical inputs that we need for reagents, as well as other aspects to build a domestic supply for testing. And also for N95 respirators, we talked about reconfiguration of plastic equipment that's needed domestically, as well as novel cellulose-based filtration material. So the point I'm making is not only building personal protective equipment, but we're also starting to identify the unique supply chains that support them within Canada to make sure that we have a domestic supply chain in order to meet the exceeding demands for personal protective equipment.
As a follow-up on that, right now, what is the proportion of PPEs that we're producing locally according to our needs? Et une question plus générale.
A more general question. How concerned are you that we may not have the equipment we need for the second wave, since we only have 10% of what we need now? Thank you.
Beginning, we have been planning for a potential second wave. And so that our contracts that we have in place now are actually operating in the short and the long term. So the goods that you are seeing and the numbers that you are seeing on our website reflect the so, for example, 42 flights have come in from China carrying PPE for Canadians and frontline healthcare workers. That's for the present time. But in addition to now, we are also planning for the potential second wave or surge or whatever you'd like to call it to ensure that Canada is at all times ready. And my final point is that we have to remember that we are purchasing, the federal government is purchasing goods domestically and internationally, in addition to the goods that are being procured by provinces and territories themselves and individual healthcare centers. And so this exemplifies the full force Team Canada approach that is occurring in this country and is so heartening to see. Merci beaucoup.
Thank you.
Glenn McGregor, CTV News. A question for Dr. Tam. We've seen a marked rise in reports involving pediatric inflammatory syndrome from the United States. And I know you spoke about this last week, but since then I'm wondering what your tracking is showing here in Canada of that. Are we seeing the same kind of worrying rise in that? And if so, how does that inform your thinking about reopening of day camps this summer or schools in the fall?
So the overall epidemiology is still that children are much less impacted by COVID-19. So that's the general data to date. So children have milder illnesses and do not get hospitalized or suffer severe impacts as one does at the other extreme of life. It is important to follow up on the signals of these inflammatory post-infectious phenomena, which is not just seen with COVID-19, but with other infectious illnesses. So pediatric networks are on alert, and they're looking at any potential cases. Right now, we're not seeing any, surges. In fact, of course, the numbers of cases are coming down as well in Canada, but you need to be ready, and the surveillance networks are ready to detect these. Some of the potential inflammatory illnesses or Kawasaki-like syndromes that have occurred in the last months. One opportunity potentially is when the serologic assays are more available, you can go back and look at some of those cases to see if they've had any signs that the kids were infected in the last month. So I think that's the kind of research that's going on right now, but no important signals at all to date on that.
A question for Deputy Prime Minister Freeland. As you know, President Trump said he's going to go ahead and hold the G7 in person in the United States. Is Canada going to send a delegation to that in person? And if so, how do you explain that to Canadians who have been told they can't travel across the U.S. border except for essential travel? Would you consider that trip to be essential travel?
Well, I think, Glenn, in the way that you have posed your question, you have captured the complexities of the issue for Canada and for the government. And it's something which the Prime Minister is looking at very carefully. Something the Prime Minister is looking at very carefully.
Thank you, Deputy Prime Minister. We're now going to go back to the phone. Operator?
Merci. Thank you. The next question is from Sharon Kirky from the National Post. Please go ahead. Your line is now open.
Hi, thanks for taking my question. It's a question for Dr. Tam. Dr. Tam, just a moment ago you made reference to the serologic surveys, and Health Canada has validated 2 blood tests now for the SARS-CoV-2 antibodies. And a lot of Canadians are wondering, was I exposed? Was that cough back in January really COVID-19? Abbott said to me that Canadians are encouraged to speak to their doctor about, what's available in their area. But what's your advice? Should Canadians be seeking antibody testing?
Is focusing. Well, I think right now the immunology task force for COVID-19 of serologic testing to give us a better idea of the extent of COVID-19 infection in Canada. So as we all know, the test positive cases are the sort of the tip of the iceberg. So these surveys are designed to see, what's the infection rate in the community. So that is the one of the primary objectives right now. So any of the serologic assays we're looking at procuring for these serologic surveys as we speak. And also you actually have to monitor the performance as you roll them out. So in actual real life settings. So those are some of the key aspects of it. I think that that's the best use of these surveys. There may be further recommendations once we know the immunology of COVID-19 in humans better. Some of the specific populations, such as healthcare workers, for example, and whether they have been exposed, but also, then what happens to the immunity might be some of the key questions. So those populations will be targeted for some of these surveys. It is not yet sort of prime time for regular use and to inform individual decision making right now.
Thank you, Dr. Shen.
I know that. One follow-up. I know that the UK said recently it had purchased 10 million antibody tests. I'm wondering how many tests has Canada purchased from Abbott and Diasorin, and what you talked about serosurveys, which ones are now underway or beginning to get underway? For example, we've seen serosurveys in LA County and New York State, where they did random sampling of, like, for example, grocery shoppers, and the background immunity was, in LA County very low. It was around 5%. New York State, it was much higher. So I'm just wondering how many of these tests has Canada purchased, and where are the serosurveys? Where are they now? Have they begun, and where have they begun?
So I know that the serosurveys are getting ready to begin, but I don't think, as far as I know, we can verify that as to whether any of it started. I think that they are actively being planned right. What I think is important in the Canadian context is that we're trying to be very careful about these surveys so that you can sort of get the best tests and also interpret them properly. So that we learn from other countries where these tests may be needed to sort of retrospectively be validated again is not where we want to be. The other aspects of the serosurveys is that they are supposed to be longitudinal in nature, so that you can test populations over time, which gives us a lot more sort of rich information as well. So they are designed a bit differently from that perspective.
Thank you, Dr. Operator. Next question, please.
Thank you. The next question is from Mia Rabson from the Canadian Press. Please go ahead. Your line is now open.
Minister Freeland, I'm wondering if you could walk us through exactly when the government was told by the military about these concerns in long-term care homes, and why it seems like it took a little bit of time for the government to act on it from the initial report.
Well, this is a serious and truly heart-wrenching report. Our government took it very seriously and acted very quickly. When we received the report, we shared it with Ontario. The Prime Minister, as he has said, himself read the report yesterday. I read it yesterday as well. And the report is being shared with Canadians today. It's important to be careful with devastating information like this and to be sure it's accurate. It's also really important for Canadians to know what's happening so that we can all act.
Mia, follow-up?
So I'm just wondering, Minister Anand, if you could talk to us about why it's taking so long to get orders for personal protective equipment filled.
Well, thank you for the question, but I see there is an assumption in the question regarding the length of time it is taking for orders to be delivered. I will note that we have been aggressive in our procurements and that we are seeing deliveries ramp up each and every week from both domestic and international sources. And so, as I said, what we did is put in place long-term contracts, and you are going to see those numbers increase for each and every item of personal protective equipment in the weeks and months ahead. And in my estimation, the deliveries that we are seeing, not only by flight, but also by ship now from China, are continuing to increase so that we can make sure that we're serving the healthcare sector and frontline healthcare workers and beyond. And the final point I will make is that we are very careful prior to making deliveries out to provinces and territories to put in place and effect quality assurance. And that is something Canada takes very seriously. And working with the Public Health Agency of Canada, we will make sure that all of these deliveries that are coming in that you are referring to are in fact meeting spec before they go out to frontline healthcare workers.
Thank you, Minister. Last but not least, Tanda.
Hi, Ministers. Minister Haidu, you said, and Minister Freeland, you said you read the report on the long-term care homes in Ontario. Can you give us some more information around that? You've all described it as serious, heart-wrenching, grave. Did it rise to the level of abuse of these residents? Did you refer the report to the police agencies in Ontario?
Thanks for the question. I think Ontario is going to be in their press conference speaking about the nature of the report.
Did you, as the federal government, though, was the question, refer the report to the police agencies?
I know that the Minister of Defense took appropriate action.
Can I just ask on hydroxychloroquine, Dr. Tam, the WHO on Friday suspended trials, and I'm curious as to whether Canada was part of that executive group that advised the pause on those trials, and if any of the trials in Canada are affected by that. I'm not sure, I can't tell from the website how many are part of the WHO Solidarity trials, how many are separate, and if you've issued any new guidance on that, if you can clarify that for me. Thanks.
I'm not aware of the Canadians being involved, but I don't know them all in the Solidarity trial decision. But I know that right now that there's a suspension of the hydroxychloroquine, chloroquine arms of those trials pending some more reviews. And so as a result, the Canadian input into that trial, that arm of the trial is also suspended for now. If you go to the Health Canada website, there are a number of other hydroxychloroquine and chloroquine trials going on. They're not necessarily subjected to the same suspension, but I think you would have to sort of get back to the trials to know that, but or the individual trials, so I think, as I've said from the beginning, the application of these drugs should be in the context of a clinical trial. At least you can monitor any specific side effects. So that's that's why I think these observations are important, and it is prudent to, again, reevaluate whether these trials should carry on as a result of some of those studies. But you have to take the whole body of evidence together and not just on singular studies. It happens, though, that this particular study is quite large scale. So, one must sort of take that seriously. And I think that is being done with the Solidarity trial right now.
Thank you, Doctor. Ceci met fin à la conférence de presse. That's it for today. Merci. Thank you.
That's the end of today's press conference. Thank you.